Swadika, a very good evening and welcome to Thai PBS World Tonight. I'm Nabunag.
I'm Tulip Naksonpop Lao, and today we look a little bit different because Thailand is under a little bit out of normal situation, and we try our best
Right.
to adhere to the government advice to stay at home. So most of us will be working from home. That means most of us will also do our news program at home.
So today we'll be doing the show live from home as well. So we'll begin tonight with the latest on the COVID-19 situation in Thailand. And a few hours ago, the Prime Minister General Prayut Chan-o-cha held a televised announcement to announce more restrictions in light of the recent COVID-19 outbreak, which has now more than 10,000 infections already. And he has confirmed that no curfew nor lockdown will be imposed from now on. And at the same time, the Prime Minister has urged the public not to panic. And he also explained that a lockdown was imposed during the first outbreak because it was necessary, although it highly affected the economy. But later on, Thailand was highly praised globally for handling the pandemic.
Yes, he also plead for the retired medic in Thailand that for the inoculation program right now that they said that they don't really have enough personnel. So he said that he would love for he didn't use the word love, but he pleaded for the retired medic and all these doctors and nurses, professionals to prepare themselves to help with the inoculation program once the country receives more vaccines.
Definitely. So basically, he's urging more medics to get vaccinated. And as we've been hearing that there has been reports that there are shortage of medical personnel as well as equipment. So he made the sort of remark so that if more medics are vaccinated, they will be able to help out other hospitals that are in need of the medics as well. In the same press conference, he also explained that the recent outbreak has proven what will happen if people lower their guards. And he also said that he's still glad that more than 90% of people still wear face masks when they're going outside. However, he's quite worried that people are not really complying with social distancing where people are so close together and go to large gatherings and all these places.
Yes, and about the vaccine, I think because there's a lot of people complain about how slow we rolled out, the country roll out, or how slow we get people vaccinated. So he talked about it back and forth quite a lot. In his speech today, he was talking about how the Thai government is actually being in contact with the Russian government to talk about maybe Sputnik will be another option for Thai government to buy, and also Pfizer. And he said that he doesn't want people to. He said there's a lot of misunderstanding among the public when some people listen to something on social media. He wasn't specify what it was or which information, which piece of information he was referring to. But then he go back to the vaccine again. So we can assume that he probably talking about when people criticize the government about the inoculation plan and how the government acquired all these vaccines. And he said there is some kind of legal issues because it's the emergency approved vaccines by the WHO. So it can only be trade. It can only be acquired from government to government, and the private sector cannot just import it themselves. And because it has to be government to government. Once the government imported, government also cannot sell it to the private sector in the country as well. So he said that what the government can do is once they have more vaccines available, they can get the private hospitals and medical institutions to help with the inoculation program.
And in regards with the lockdown and the curfew, well, let me put it this way. He mentioned that the recent restrictions that have been imposed before, he admits during the press conference that he is hurt after having to impose the restrictions, as it really affects everyone's livelihood, especially those with low income. And many of the decisions were very difficult to make, but he tried his best to listen to everyone, and it is his job to solve the problem. As we've been mentioning, we've been reporting that although there have been lockdowns and restrictions have been imposed, it has highly affected many of the businesses, especially those with lower income, because they have to make a living. And when they impose the restrictions, they couldn't do anything and they have no income.
Yes, he also said that he referred to some other countries that have like 10,000 of people die every day. So he said Thailand is still in a better situation, so it's not that bad yet. But he made this thing though, this statement though. He said Thailand has to win. I remember last time, if you remember last time when he was having the big televised address about COVID-19, he also said something like, we will win. So this is pretty much similar kind of statement, but this time said, we have to win.
And another special remark he made is that Thai people should be proud of themselves in fully complying with the previous measures that have been imposed to prevent the spread of COVID-19, which he considered it to be very special because it's something that people are willing to comply right here.
Yes, he also defend his decision, I guess, because there's a lot of criticism of some of his decision, whether it's a lockdown plan, inoculation plan, some restriction and such. He said every decision he's made, he has necessary information and advice from the expert in the field on the medical professional and things like that. So he said he didn't make all this decision on his own. So he tried to make sure that the public understand where all this decision came from.
Right. And to remind you, there's no curfew nor lockdown imposed, but what they have imposed instead is the COVID zoning system, which has been readjusted to coincide with the current situation. So as we previously reported, is that before we have like four colored zones, right? So
Right.
red, orange, yellow, and green. But now it has changed to only two colored zones only. So it's red and orange only. So this is according to Thailand's National Communicable Disease Committee, which has revised the COVID-19 zoning system, which is in line with the worsening situation here. So as we mentioned, it has been divided into two colored zones. So it's red and orange.
And it spread to all 77 provinces already. So according to the committee that met yesterday under the chairmanship of Public Health Minister Anutin Charnvirakul, the number of red zone provinces has been increased from 5 to 18 due to the current surge in daily infection and the rest of the country, of course, in orange zone, which is 59 provinces. So under new zoning, all bars, pubs, and massage parlors across the country will be closed, including those in 41 provinces already closed for 14 days since last Friday. The eateries in the red and orange zones are not permitted to sell alcoholic drink to their customers and may only stay open until 9 p.m. in the red zones and 11 p.m. in the orange zones. So all the activities with more than 50 attendees are banned unless there is prior permission granted by the Provincial Communicable Disease Committee in each province. So all private parties are prohibited unless among family members. But even that, the Prime Minister asked earlier that this is the part that he also worry a lot is the social distancing, that whether people would try to practice social distancing among the member families. So according to the latest announcement, all classroom in red zone and orange zone all the classroom teaching is suspended, and all amusement parks and amusement backgrounds in malls are closed. The private sector is urged to arrange working from home. So it's not a mandate that everyone has to work from home. It's more like asking for cooperation from all these companies to let their employee work from home. And also, but the school is a mandate for school to closed for classroom, in class learning. So at least next week or so, all the students across Thailand will have to do the online learning again.
Right. So basically, work from home is advised, and all schools will be closed, as well as eateries will have to close at around 9 p.m. in red zones and 11 p.m. elsewhere as well. And all of these measures will come into effect this Sunday, which is April 18th, and it will be effective for around 2 weeks.
I wonder whether there are going to be people go out and party on Saturday night, like in Belgium before they go into lockdown, and they're going to ban all these parties and social events. People just went out and party like very hard before.
I remember there was like in Belgium and
Yeah.
where else? In London and Paris as well, where they decided to party really hard before the lockdown.
It's like a farewell party.
Yeah, so I wonder if there's going to be any in Bangkok. But anyway, because of the infections that came from entertainment venues, probably it might stop people from partying during that
Yes.
time. And now let's move on to the latest figures. And Thailand has recorded 4 digits once again, and it has also made a record breaking. And they have also made another record as well, because Thailand recorded 1,582 new COVID-19 cases today. And it is also the highest number so far. And the disease, like you said, it has already spread to all 77 provinces. And of the new infections today, 312 are in Bangkok, 272 are in Chiang Mai, 101 in Chonburi, 100 in Prachuap Khiri Khan, and 40 in Samut Prakan, and 59 in Lampang. So to give you a better picture of the newest COVID-19 outbreak, we can see that the new cases raised the cumulative infections in the latest outbreak, starting from April the 1st up until now. It's around 10,175 already. So what we're seeing right here, if you look at the chart right now, the number of daily new infections have been increasing like every day, particularly since April 5th, where infections coming from entertainment venue clusters were first recorded. However, it was not until the Songkran holidays where we saw record-breaking numbers. So if we remember, like since the 10th or 11th, we're seeing like 900 cases, and 2 days ago we were shocked with 1,335 cases, and that was, we thought that it was going to be the highest, but we can see that the numbers are really increasing right here.
There's a lot of people say that, well, if you compare to the number of population, the 1,500 a day in percentage, it's not as scary as many other countries. But for Thai people that we never have 4 digits before, I think these last several days has been quite scary for a lot of people.
Definitely. And even people like us, we were really surprised to see 4 digits. And for 3 days straight already, we're seeing 4 digits, and we're seeing record-breaking numbers as well. And according to Dr. Chawetsan Namwat of the Disease Control Department, he said that the number of new infections since early April has increased every single day. And the inoculation period of the virus is at least 7 days as well. Since the third wave of infections began, he also said that there have been several new clusters, such as the one linked to the student volunteers in Chiang Mai, which has already spread through 13 provinces. And there was also another cluster linked to a food shop in Nakhon Ratchasima, which has already infected 40 people. And there's another cluster in Kanchanaburi, which is linked to a school, and it has already infected around 28 people so far. And another cluster is in Nakhon Si Thammarat, which has already spread to 3 more provinces and has affected about 20 people. So you can see that it's not only the entertainment venue cluster anymore, but there are new clusters here and there. And that is probably why we can see that all of the infections, all of the provinces are now like infected with COVID-19.
Yeah, because a lot of cases, most of the cases, the country discovered right now with the UK variant, which means mostly asymptomatic and very spread very fast. So some
Definitely.
people didn't know that they have this virus and they still go out and do things like they do normally. And maybe if they are not haven't been very strict with wearing masks, washing hands, and keeping distance, they will infect other people, not knowing that they're having virus in their system.
Definitely. And Dr. Chowetsan also said that the emergence of new clusters poses a very high risk for travelers who may have been in contact with more people without even knowing that people may have been infected with COVID-19 because, like you said, most of the new infections are asymptomatic. And as for the figures today, the cumulative infections in Thailand since early last year is now 39,035, with 9,800 people still being treated in hospitals, and the death toll remains at 97, and 16 people are in critical condition.
So I assume if we got 4 digits again tomorrow, of our cumulative infection cases will hit 40,000.
It is definitely expected right here.
Yes, let's come back to the vaccine issues. We have heard that many countries right now are very worried about AstraZeneca. It's one of the vaccines that a lot of many countries has been using, and Thailand is one of them. So Denmark recently just announced that they will stop using AstraZeneca. And the latest news from Denmark is that they will give away this AstraZeneca to low-income country because they already stopped using it.
Right.
So Thai public health minister said that Thailand will continue with the use of AstraZeneca vaccine anyway. And he said because authorities have not found any rare but significant and serious side effects among the vaccine recipients in Thailand. Mr. Anuthin Charikul, the public health minister, chaired a meeting of the National Communicable Disease Committee, during which he informed those present the problem with the AstraZeneca vaccine in Denmark. So like I said, several days ago, Denmark announced it will stop using the AstraZeneca vaccine altogether, becoming the first European country to do so over suspicions of rare but serious side effects. Denmark's vaccination campaign, however, will go ahead without AstraZeneca. The European Union's watchdog said that it had found a possible link between the vaccine and very rare blood clots, while cautioning that the risk of dying from COVID-19 was much greater than the risk from rare side effects.
Okay, that's a very interesting mark here.
Yes,
that's a very interesting remark.
I think they're just scared. They're just afraid that maybe people are scared of the side effect enough that they stop taking vaccination, which in the expert eyes, the side effect probably not gonna get you so sick that you die, but COVID-19 has higher chance to kill you. So Anuthin told the media that the use of COVID-19 vaccines in Thailand was in close consultation with a panel in charge of their safety. And if there is any instruction from the panel that the use of AstraZeneca should stop, then the Public Health Ministry will follow suit immediately. That's what he said. And he said that the panel has been closely following reports of serious side effects from AstraZeneca in several countries and acknowledged that there were several causes or conditions prompting some countries to suspend or stop using the vaccine. But there has not been any instruction from the panel to stop to suspend the use of the vaccine in Thailand. So we can see here that both Prime Minister and the Public Health Minister, which he is not a medical personnel himself, but he running the Public Health Ministry, he has been listened very closely and listen to the advice from the expert. So Mr. Anutin reiterated, however, that the Public Health Ministry has always attached importance to safety and will consult the committee whenever there are reports of serious side effects from the vaccine. So if you wonder, right now Thailand using two kind of vaccine, AstraZeneca and the CoronaVac from Sinovac in China. And we have vaccinated, I think, less than 1% of the population. So that's why the government has been criticized for not roll out this inoculation campaign fast enough.
Because we can see that if you look at the numbers from the CCSA, there are a group of people that have already received their first dose. But if you look at the people who received their second dose, it's much lower than the first one. So we can see that the government has been widely criticized for not doing enough with the vaccines.
And the vaccine like Pfizer, today their CEO has said in the statement that for Pfizer, which Thailand is not using Pfizer, but the Prime Minister said we are in contact with the company in US. The Pfizer said that anyone that has been inoculated might need the third shot in 12 months. So there's a lot of people that already received the shot since probably the beginning of this year or the end of last year. So soon enough, before anyone get their first shot in Thailand, they will need the third shot already.
Right. So 3 shots as opposed to 2 shots with the
3 shots if you want it to last more than 12 months.
Right. So that's a lot here. And now let's move on to the issue of field hospitals. People are quite worried that if there are enough beds for patients, that as we can see that the number of infections are increasing every day. And recently, the Bangkok Governor Kwan Mueang has inspected the Bang Khun Thian Geriatric Hospital, which has been used as a field hospital to monitor asymptomatic COVID-19 patients and also observe the vaccination process at the hospital as well. Aswin said that almost 500 people were waiting to be inoculated on the first day, which is today after the Songkran holidays, and that leads to a shortage of medical staff as well as necessary equipment. So therefore, they have already coordinated with other hospitals to provide additional staff and equipment. He also said that he has ordered the director of the hospital to add 500 more beds as well as to expand the area on the second floor of the hospital to prepare for more patients, as 400 beds have already been occupied. And for the initial part, 400 beds out of 500. That is a lot here. And recently, the Bangkok Metropolitan Administration has also coordinated with 11 hospitals under its administration to prepare for more patients as well.
And also earlier today, the commander-in-chief of the Thai army, he also come out and said that the army totally supportive of building the field hospital, and they have already prepared numbers of field hospitals around the country to make sure that we have enough beds for the people that get infected with COVID-19. There's a little bit different policy in Thailand from many other countries. In a lot of countries, people that get infected, if they are symptomatic or they have mild symptoms, they will be asked to just isolate themselves at home and take care of themselves, so to speak. But in Thailand, anyone that tested positive for COVID-19, having symptoms or not, they will ask to stay. Not ask, they have to stay at the hospital. So if the normal hospital beds are filled, they have to go stay at the field hospital instead.
So basically, what I've also heard is that if you've been tested positive for COVID-19, but you choose to stay at home, you might be prosecuted as well.
I'm not sure about that. I think the government hasn't been, if there is a law there, the government has not been clear enough to explain that. But
Right.
what we know is if any hospital give you a test and they found you positive, they have no other choice but to admit you to the hospital. So last week, that's why we have a news of a lot of hospital have to close their test service because they don't have enough people, or they don't have enough beds to facilitate the infected already. So they have to just stop and prepare themselves again.
Right.
And anyway, let's go to another aspect of COVID-19. As we know that it affects a lot of people, it makes a lot of people out of work. So the latest study said that 6 million Thais rendered jobless by COVID-19 pandemic. It's about 6 million, not exact, it's about 6 million since COVID-19 pandemic struck Thailand early last year. And 1.3 million university and college graduates are unlikely to find jobs or have opportunities to develop their capabilities. That is very alarming. So according to Mrs. Kempet Senapan of the Thai Health Promotion Foundation, citing a survey of people affected by the COVID-19 pandemic conducted by the National Statistical Office in cooperation with Thailand Development Research Institute, or TDI, and the UN Children's Fund. She said that Thai people in aged 15 to 24, especially those in their last year at the university, are likely to be unemployed after graduation because most private companies have halted or slowed recruitment. And she said that most Thai workers do not have saving plans and hence do not have a nest egg to rely upon if they are laid off. So the most workers are not capable of adjusting to alternative jobs once they are laid off. So that is a big issue. If you have been following some of our scoop last week, no, actually this week, we interview one of the, actually last week, we interview one of the company, the big recruitment company. Is they actually big in the world? They're also big in Thailand. They mostly recruit a high-ranking employment, but they also did a research on the job trending in Thailand and many other countries in ASEAN, in Asia as well. And they said that a lot of companies slow down on hiring new one, or if they hire new one, they will be very cautious about just give a big salary to just one position. So there's a lot of things to be looked at this year. And but she said that even though you're a new graduate, you have advantage if you are very good at technologies or any skills that relate to tech. There's still a lot of demand in the market, in the jobs market, but there's not enough people that are able to do the job.
And unfortunately, because of the COVID-19 situation, sadly, there will be tons of new graduates who will not be employed this year. And compared to other situations, even like few years back without COVID-19, new graduates already have difficulties finding new jobs anyway, and especially with the pandemic, it will be a lot harder for them. But there is still a way if they embrace with the new skill sets that are related to technology, knowing different programs and all these things, because these kind of people are in high demand at the moment, because like when we do things, everything requires technology, and it has been part of our lives these days.
And this year, new graduate has to compete with the people that has been unemployed since last year. So the competition is pretty fierce, I would say.
Definitely. And you can stay at home and stay informed with Thai PBS World. You can check out our website, thaipbsworld.com, for the latest news on COVID-19, as well as other news as well. And you can also follow us on our social media platforms, Facebook, Twitter, Instagram, YouTube, and TikTok as well. And that wraps up tonight's edition of Thai PBS World Tonight. Thanks for watching, and we'll see you next week. Stay safe as well. สวัสดีค่ะ
สวัสดีค่ะ